Hello, this is Dr. Gil Wilshire at Missouri Fertility. This is our Just the Facts series where I answer questions that I frequently receive from patients and from viewers like you. If you have additional questions, please put them in the comments section below. One of the most common conditions I treat in my practice is endometriosis. Women are frequently curious, do I have endometriosis? Well, there are three common symptoms with endometriosis that should alert you to the possibility of having this condition. The first, most classic symptom of endometriosis is painful periods. The medical term for this is dysmenorrhea. Women can describe it as a little bit of cramping, some pretty bad cramping and pain with their periods, or incapacitating painful periods that'll put a woman down for 2 or 3 days a month. It's not uncommon for women with such pain to have dark discoloration and darkening of their abdominal skin from all the hot water bottles and heating pads that they've used over the years. So this pain can be very incapacitating, and it should alert any woman or healthcare practitioner that you might have endometriosis. If you have lost a day of school or work at any time in your life due to a painful period, you have at least an 80% chance of having endometriosis, and this should not be ignored. A second common symptom of endometriosis is pelvic pain. This is pain that can come anytime during the month, not necessarily during menses. A woman with painful periods might notice that over the months and years that pain in the middle of the month, particularly around ovulation, is getting worse. There can also be worsening symptoms of bowel irregularity. It's frequently called IBS or irritable bowel syndrome, but it is frequently caused by a condition outside the bowels, frequently endometriosis. Inflammation can occur at any time of the month, so these irregular bowel symptoms can occur at any time and should not be discounted even if they're happening at a time outside the menses. A third common symptom with endometriosis is pain with intercourse. Now, there's different types of pain with intercourse, but the type of pain we're talking about usually is deep pain. This is pain that occurs very deep in the pelvis. Sometimes it can be towards the back, towards the rectum, or towards the front, towards the bladder, but frequently it's with deep penetration, frequently in the dead center of the pelvis. Sometimes the pain occurs more after intercourse. There's a prolonged aching and pain that can occur for hours afterwards. But whatever the pain symptoms are, they are not normal and should be evaluated. So those are the three basic cluster of symptoms women can get with endometriosis: painful periods, pain throughout the month, and pain with or after intercourse. Thanks for watching. Be sure to like and subscribe.